city so they can see us over.
Control, mate, thanks. Keep the momentum going, guys.
This was a big...
Will you put her in oxygen? Radio so that you can hear if somebody calls us. That's it. That's my only concern.
Two of you only?
Two of us only. She's right. But I want you to prepare.
We prepare the next.
Can we get a head count for how many more spaces we have?
You still have one patient on a wheelchair, one patient on a stretcher can be fit in the ambulance.
If everyone in Gaza is hungry, this includes 50,000 report from UNRWA.
On Sunday and yesterday, there were 32 critical patients, including 2 children, that have been transferred to other hospitals in southern Gaza. These missions were connected in the close partnership with Palestine Red Crescent Society and W.H.O. The team also provided limited supplies of essential medicines and food for the remaining patients and staff who are otherwise cut off from aid.
Gentlemen,
It's okay.
is the ventilator has UPS?
It's control. Portable?
Yeah.
Portable ventilator?
Yeah.
Okay, we're fine. هاي الثانية يا دكتور. الطفل ده ما نقم طعيمة كويسة. ما قام دكتور عاطف مدير المستشفى.
كيف اخبارك؟
يقول لك ايش؟
خفيش يا عمو خفيش.
Now, Nasser Hospital, as you could have seen in the footage, yesterday has no electricity. There is also no running water, and medical waste and garbage are creating a breeding ground for diseases. WHO staff said the destruction around the hospital was difficult to describe. The area was surrounded by burnt and destroyed building, heavy layers of debris with no stretch of intact.
1, 2, 3.
Move back. Okay. Yep. Exactly. We're good? We're good.
Perfect. Oh, give me the belts.
All habits die hard.
Estimated 130 sick and injured patients and at least 15 doctors and nurses remain inside the hospital. As the intensive care unit was no longer functioning, WHO staff transferred the only remaining ICU patient to a different part of the complex where other patients are receiving basic care.
The patient has to be moved with an ambu bag.
Yeah, we have.
With an ambu bag?
Yeah.
Okay, so one in the head.
One with the ambu bag.
Now, this degradation of Nasser complex is a massive blow to Gaza's health system. Facilities in the south are already operating well beyond maximum capacity, and the capacity of those 6 health facilities in south are only 450 beds, and the needs are much bigger. We repeat our call for protection of patients, health workers, health infrastructure, and civilians. We also call for parties to uphold international humanitarian law and the principles of precaution, distinction, and proportionality, and to ensure sustained access so hospitals can continue providing life-saving care.
Speak a bit more about the children. You said that some children were among them, and also are there any remaining?
Radio, so that you can hear if somebody calls us. That's it. That's my only concern.
So you feel comfortable?
Are you comfortable?
Okay. Wait, okay.
You're good?
Yeah.
Let's go.
Two of you only?
Two of us only.
Good.
But I want you to
We prepare the next.
We were shocked what we actually saw in Nasser Medical Complex. There's waste everywhere. Electricity was not working. Parts of the hospital are damaged and some severely damaged. The central drugstore, which was the drugstore, actually part of Nasser Medical Complex, which delivered drugs and medical supplies to the whole of south of Gaza, destroyed. Unfortunately, with a lot of the supplies as well from W.H.O and partners. In the meantime, we should immediately start rebuilding and making sure that Nasser Medical Complex remains and becomes functional again as the referral center south of Wadi Gaza.
Sarah, can we get a head count for how many more spaces we have?
You still have one patient on a wheelchair, one patient on a stretcher can be fit in the ambulance.
Ambulance.
Finished.
It's finished.
Can we change for another
And that's why
ambulance?
we have to leave.
That's what
soon.
Dr. Muhammad
It's okay. Is the ventilator has UPS?
It's control. Portable?
Yeah.
Portable ventilator?
Yeah.
Okay, we're fine. هاي الثانية يا دكتور. الطفلة نغمة طعيمة كويسة. ما قام دكتور عاطف مدير المستشفى.
كيف اخبارك؟
لك ايش؟
خفيش يا عمو خفيش.
My words are not enough to express the respect that I'm feeling not only for you but for these people that have worked here.
Move back. Okay. Yep. Exactly. We're good.
Perfect. Oh, give me the belts.
All habits die hard.
This is the former emergency department of National Medical Complex. And it's a death zone. This is, you can see the limb reconstruction unit dedicated in memory of Dr. Peter Salama. This place used to reconstruct limbs of patients that otherwise would be amputated. Now this place is no longer operational.
Sorry?
Yeah. The patient has to be moved with an ambu bag.
Yeah, we have.
With an ambu bag.
Yeah.
Okay, so one in the head.
One with the ambu bag. Excuse me?
Yeah.
That was a really complex mission. And we should follow up with more like them.
ارفع رجلي ارفع ماشي كمان واحدة كمان واحدة ارفع
رجع حالك حطينا لك مسند حطينا لك مسند
اسمك انت ايش اسمك؟ حلو انا حاحكي مع دكتور اياد الجبري طلع فيا انا حاحكي مع دكتور اياد الجبري بعد الغسيل تبعك لازم تغسلي اللي صار لي 7 ايام ما غسلتي
Pinpoint, bone, very surgical. And that's what we're still on.